Today, high blood pressure, hypertension is probably the most modifiable, common and major risk factor for heart disease and stroke across the world. About 1 out of every 3 adults has high blood pressure, and the numbers are increasing as the country ages and become more overweight. High blood pressure can cause damage to the heart, blood vessels, and, over time, the kidneys. Current findings suggest that high blood pressure is an even more widespread health problem than previously understood. Even if a person does not have high blood pressure now, by the age of 55, he or she has a 90% probability of having it later in life. Furthermore, new data suggests that the artery damage that leads to heart disease, stroke, and other serious problems begins at blood pressure levels that were traditionally considered normal by doctors. The higher your blood pressure, regardless of additional risk factors, such as high blood cholesterol or being overweight, the greater your risk of heart disease or stroke. Hypertension is known as the silent killer, since it causes no symptoms in and of itself, but it can lead to stroke, heart attack, and kidney failure, all of which are fatal. Blood pressure is typically recorded as 2 numbers, and written as a ratio like this. Systolic, the top number, the higher of the 2 numbers, measure the pressure in the arteries when the heart beats and muscles contract. Diastolic, the lower number, the lower of the 2 numbers, measures the pressure on the walls of your arteries between heartbeats. Normal blood pressure is considered to be less than 120 by 80 mm mercury. You are classed as prehypertensive or hypertensive if your blood pressure is equal to or higher than this for 2 or more readings on different days. Based on the effects of high blood pressure, the guidelines are designed to get you and your doctor started on lowering your blood pressure as soon as feasible. Types of high blood pressure. Normal systolic and diastolic pressures are less than 120 mm mercury and 80 mm mercury, respectively. High blood pressure with a diastolic pressure of 120 to 129 mm mercury, and a diastolic pressure of less than 80 mm mercury. Stage 1 hypertension is defined as a systolic pressure of 140 to 159 mm mercury, or a diastolic pressure of 90 to 99 mm mercury. Stage 2 hypertension is defined as a systolic blood pressure of 160 mm mercury, or diastolic blood pressure of 90 mm mercury. If your systolic pressure is greater than 180 mm mercury and, or your diastolic pressure is greater than 100 mm mercury, call your doctor right away. Your first reaction may be a surprise if your doctor diagnoses you with hypertension because you are feeling fine. That is not uncommon. Many people go years without realizing they have high blood pressure since it has no symptoms. Your heart, brain, and kidneys can withstand high pressure for a long period, and you can live without symptoms or pain for many years. However, because hypertension is a major risk factor for serious diseases, obtaining therapy to lower your blood pressure is critical. High blood pressure has 6 main effects on the body: atherosclerosis, stroke, aortic aneurysm, enlarged heart, kidney damage, and eye damage. Simple 7 easy steps that protect you from developing hypertension. Start eating a low-fat and low-salt diet. If you are overweight, you should lose weight. Daily exercise. Quit smoking. Sleep well. Learn how to deal with stress. Decongestants and energy drinks are examples of over-the-counter drugs that can elevate blood pressure.